Talk about having a life-changing experience within a twinkle of an eye. Meet Dish.
So I woke up from my coma. I'm a bit like discombobulated, sitting there. My partner's there. He's telling me that I've just been sleeping for a week. I'm thinking he's joking. All my family members are turning up now. Everyone's crying. I thought it was a big joke, like someone's gonna come out and say, "You got pranked." And then they showed me my body. They pulled back the covers. I saw my hands and feet, which were damaged black.
Last year, April, Dish went to the hospital to have what she thought would be a normal having a baby. She was pregnant with twins. She had 2 previous children, so she thought she would just go in, have her twin babies, and go home. This is Dish, and these are her beautiful twins. She went to the hospital, had a baby. A day after having the baby, she was discharged to go home, which is normal, especially if you had a normal vaginal delivery. She went home, but while she was at home, the day after, she started feeling unwell. She couldn't eat, had loss of appetite, she was vomiting. She had her concern. She called the midwife, who she explained to and told, "Look, I'm not feeling well. I don't think I'm okay. I feel like I'm gonna die." The midwife told her it is normal, this is expected after delivery. Say, listen to your body, and when you listen to your body, express how you feel. If they don't listen to you, seek a second opinion. I'm not blaming anybody here. I'm just, adding my own input as I go. The midwife said, "You're fine, it is normal," left. Dee was not satisfied. She continued to vomit, continued to feel unwell, and thought, I need to call an ambulance. She called an ambulance. Ambulance got her to the hospital. She continued to vomit. They put her in resource. And as you know, the NHS, if you've been to the hospital, I went to the hospital some days ago with my uniform when I had this tie in my eye. I sat in the reception. I was on duty. It was my break period. Until my break was over, nobody attended to me yet because the NHS is overburdened. Now, Dish was left to wait for hours, just like every other person. When she was eventually attended to, she was going in and out of consciousness. And once your GCS is beginning to reduce, as a nurse, this patient is now needing to be transferred to ICU. It is becoming really serious. She's now dehydrated. Even though, according to her, she said she's been drinking water, but she felt she wasn't able to quench her thirst. IV has not been started. She was vomiting. She was becoming septic. And unfortunately, antibiotics had not been started. No medical interventions that would have helped or improved what would then later happen to Dish was not implemented. Dish continued to become unwell. When they saw that this was getting serious, she was beginning to lose consciousness. When you're beginning to go in and out of consciousness, maybe GCS is now reduced. She was then transferred to ICU, where she then had induced coma.
I was in ICU, then I went to HG, and someone had come to visit me, and that's when I first was told that I need amputation.
What was that like, receiving that information?
Crazy. I was like, no, that's not happening. I'm not agreeing to that.
Were they able to tell you how you contracted sepsis?
From the strep A.
And did they tell you how you got the strep A?
No. They cut off the below the knee of the black parts.
Yeah.
And then on my left arm, below the elbow, the right hand was fine. It's just the fingers were dead.
All of the fingers?
Yeah. But I was grateful for the right hand to not lose that whole hand as well.
I work in intensive care unit and I know what this means. It means you've been sedated, you're going to be unconscious. And unfortunately, while you're unconscious, I'm not there, I didn't nurse Dee, I wasn't there, I don't know what happened, I'm just saying. Once you're unconscious, you're not able to sustain your blood pressure most of the time. Your blood pressure may be reducing. I feel some medication might have been used that might have contributed to her beginning to have, you begin to have cold extremities, dark color extremities. I've seen loads. And some will come out of it, some will never. And even with the sepsis she had, by this time now she's not been diagnosed that she has sepsis. And if you know sepsis, it is very serious. It affects the bloodstreams. It is infection all over. It spreads really quick. In fact, it is life-threatening. Once you have a septic patient, you're going to be on your toe until you're able to stabilize the patient with so many things, antibiotics, fluids, so many, like, it does depend on what is being affected. So I can imagine at this stage what is going on in the mind of the family, of her partner, For the fact that she has 2 older children, what was supposed to just be a normal delivery. Now, Dish is in the hospital, she's in ICU. She was in ICU for a whole week. Okay? She was in ICU for a whole week. During this period, now her hands, her legs, her extremities, in fact, I've seen where the ears, the nose, just because the medication, some medications that we give usually divert the blood from the peripheral blood vessels to the central blood vessels, in a simple man language. So the veins and blood vessels that supplies the areas that does not have your vital organ, these medications has a tendency to squeeze them away from that area to supply your vital organs like your brain, your heart, your lungs, your kidney, those organs that are very important and that needs the blood the most. I don't know what happened. Anyway, I've seen it in so many cases where you begin to lose some part of your body even though you're still alive. So this lady's hand became as dry as dead. They became necrotic, that is dead, and she was still unconscious. Now the problem is she has to go through amputation. Dish said she woke up and saw her husband, her partner, at the edge of the bed, and when she lifted the cover up, she couldn't believe her eyes.
I thought it was a big joke, like someone's gonna come out and say, you got pranked, and then they showed me my body, they pulled back the covers. I saw my hands and feet, which were damaged black.
Most parts of her legs are gone. I think she managed to leave a little bit of her fingers were affected on the right side, but she had a little stump left on the right side and the other hand cut. Imagine getting pregnant, you're happy, you're thinking it's going to be a wonderful experience, and then you end up being a complete amputee. And some people will ask you, I know, some people will just, ask you, yeah, it's just having babies. My grandmother had 8. My great grandmother has 20. These are things that can happen because you're trying to bring life. And it is not actually just attributed to having babies. Sepsis is something that can happen randomly to anybody. But one thing I want us to learn from this story is when you begin to feel you're not well, especially as many immigrants in this country, please speak out. For instance, I saw a lady's video where she was sharing that she's a doctor. She went to attend to a patient, and when the patient reported to the hospital, the patient is obviously my skin color. They thought one of her leg or both of her legs was actually necrosed, like dead, because of the color. When she went to check, she's like, no, this lady is just darker on the leg. And they were already talking about amputation, this, that. So it is actually a bit difficult for us to be able to understand and blend in and ask for help when we need to, or for anybody to understand us. When it comes to skin conditions, it is difficult to diagnose and to actually take it seriously. But if you begin to feel unwell, shout out. Speak out. It is better you go to either A&E, to the emergency department, and they turn you back and say you're okay, or and you've sought another opinion, than for you to think, oh, they've said I'm okay and I'm okay. I've had instances where somebody had even approached the hospital and over the phone they said, oh, you're fine, come to so hour. By the time they gave him an appointment, turned up to the appointment, it was too late. It's actually a shame. I feel so bad for this. In fact, her spirit, I've watched her video, I was watching her videos all night. Her spirit, her positivity, her oh my God, her courage should be studied. The babies are now growing, they are beautifully growing, but at the end of the day, it is still a very sad experience. If you're in her shoe, what will you do? Will you be suing the hospital? Will you just take it as the will of God? Do you think there were things that would have been prevented? There have been so many comments and so many versions of this saying this will have been prevented. I think I saw this case when it first happened last year, but it is now resurfacing for some unknown reason. And I thought I should share. Listen to yourself, listen to your body. Don't take anything for granted. And when women tell you this is what they feel, or if anybody at all tells you this is how they feel, do not dismiss them. For the fact that it is not true for you does not mean it is not true for that person. Especially as a medical person, this video has actually taught me as well to be more vigilant, to be more listening, to be more understanding, because this woman kept saying, I'm not right, 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 until it became bad. You see, I don't know if this will have been avoided or prevented, but at the end of the day, we should learn to listen to people and not dismiss, even if you're not a medical personnel, you're not a nurse, you're not a doctor. I'm not here for us to start blaming anybody. I'm just saying, even if it is just your friend, somebody has just told you how they feel, don't dismiss them, because that is not true for you. It does not make it a lie for them, okay? Thank you so much for watching. I may your humble girl, Gloria Oteko. Please remember to like, subscribe, click on the notification bell. If you don't know me, please follow me so you can know my journey. I share tips, I share stories, I share things about the UK, abroad, wherever I am, and I hope it helps you. Thank you so much for watching. I will see you in another video. Until then, stay safe, take care, and I'll see you later. Bye.